this is my Module 3 discussion board post. My patient's initials are BB. She is a 47-year-old female. And she came into our office with complaints of what she thinks is a UTI. She came in stating her symptoms started about 2 days ago, and she doesn't feel like anything precipitated her current symptoms. She states that she has had UTIs before, and this feels very similar to what she has had in the past. However, the only thing that is different this time is that she has had a new sexual partner within the last 2 weeks. She's not had intercourse since the symptoms started, and she's not done anything at home or done any remedies to treat the symptoms herself. She reports pressure in her pelvic area and now has frequency and burning with urination. She doesn't notice any changes in odor of her urine, and she states that her urine is clear and yellow. Past medical history, scoliosis, and surgical history, breast augmentation, and a hysteroscopy with an endometrial ablation. She did also have a back surgery to correct her scoliosis when she was young. Current medications that she's on: Motrin 800 PRN for her back pain, and then she takes a women's 1-a-day vitamin. Family history, both her parents are deceased, and she has a sister who has postmenopausal breast cancer currently. Psychosocial, she denies anxiety, depression, or any history of mental health problems. She does not use any drugs or illicit substances. She's never smoked and never used any kind of smokeless tobacco. She drinks alcohol socially, about 2 to 3 glasses of wine per week, and is sexually active and is not on any kind of contraception, as she is menopausal. For review systems, she denies any chills, fevers, or fatigue. Respiratory-wise, she's no short of breath, no respiratory symptoms, coughing, wheezing. Cardiovascular, no leg pain, chest pain, swelling. GI, no abdominal pain, constipation, nausea, or vomiting. For GU, she does report pain with dysuria and frequency. She does not have flank pain or any blood in her urine. She also reports increased pressure in her pelvic area. Skin-wise, she denies any itching or rashes, particularly in her perineal area. And for endo, negative for polydipsia. And psychiatric, she's negative for any kind of depression, suicidal thoughts, or ideations. Objective-wise, her vital signs: blood pressure is 97/62, pulse of 87. She's afebrile with a pulse of 36.7. And her BMI is 22.1. So in the office, we did a urine dip, and her urine dip did come back with trace blood, positive nitrates, and large leukocytes. On a physical exam, constitutionally, she's oriented to person, place, and time. She's well developed, no distress. She's a good historian. Abdominal, her abdomen was soft. Bowel sounds are normal. There's mild tenderness with deep palpation to her lower abdominal area, and there's no CVA tenderness. GU, the urethra is intact, no evidence of lesions or skin breakdown, and there's no vaginal odor or abnormal discharge upon our exam. Neurological, she's oriented. Skin is warm and dry, no lesions, and that's it for her physical exam. So at this point, based on her urine dip and her physical exam, as well as her HPI and symptoms she's been reporting, our differential diagnoses are a UTI, a kidney infection, urethral laceration, or some kind of urethral irritation that's causing this burning with urination, or gonorrhea and chlamydia, given that she has had a new partner in the past 2 weeks and is having some urinary symptoms that we know can present with gonorrhea and chlamydia as well. But we did end up diagnosing her with a urinary tract infection. We sent her urine for culture as well. But we went ahead and prescribed her Macrobid, 100 milligrams BID for 5 days, based on the CDC and up-to-date current first-line therapy recommendations. For teaching, we discussed urinating before and after sexual intercourse to try to keep everything clean and to eliminate any bacteria that could potentially travel up the urethra during intercourse. We talked about proper cleaning after intercourse and educate her partner to also practice good cleaning practices. We discussed taking pyridium over the counter just for symptom management if she feels like that would help her. We did discuss that pyridium can turn your urine bright orange or red, so that she might want to wear a panty liner while she's taking that because it will stain your clothes. But again, we told her it's not mandatory, not mandatory, but that she could take that if she felt that that would help relieve her symptoms also. And then we would like her to call us or return to the office within a week if she doesn't feel like her symptoms are better or if they have gotten worse. So 2 days later, we actually did get the culture results back, and it came back positive for E. coli, and we did a culture and sensitivity, and it was sensitive to macrobid. So we called her and just let her know that the drug that we prescribed her was appropriate for her the bacteria that she had in her urine, and to keep taking it as directed. And when the time that we called her, which was we got the results on the 2 days after. We called her on the next day, and she had already had a good start of relief in symptoms. So we just encouraged her to continue the course and to not stop taking it because her symptoms have started to improve. But to continue the full course and let us know if she had any problems from there. So that's it.